talk about a new application of hyaluronic acid in nasal surgery. We know that chronic inferior hypertrophy is one of the most ENT problem, and more or less we can think that approximately 50% of the population show inferior turbinate dysfunction. We have a lot of drugs to reduce inferior turbinate volume, like topical corticosteroid, antihistaminics, nasal washing, topical vasoconstrictor, but we well know that the effect is partial and short. There is a low compliance and sometimes side effects. So now in the Western countries we usually perform minimally-invasive turbinate volume reduction technique. This technique, like the ancient turbinectomy, doesn't require hospitalization, tampons, and no rest, but like the ancient turbinectomy, and in the first weeks after the operation, the patient has nasal discomfort, because there is the formation of edema, crusts, and nasal congestion. A lot of techniques were proposed to reduce volume turbinate. There is not a consensus on the optimal technique, but an ideal procedure for turbinate reduction should produce an improvement of nasal breathing with minimal dose discomfort for the patient. We usually, in Italy, in my university, we usually use radiofrequency inferior turbinate volume reduction under 0-degree endoscopic vision. And we know that radiofrequency cause a fibrous proliferation and scalp formation in the submucosa, the obliteration of the submucosal small vessels, and the destruction of the submucosal gland. Several different solutions are usually proposed to reduce the discomfort for the patient in the first month after the local operation, like isotonic hypertonic solution, ocean water, oil balsamic solution. But according to us, hyaluronic acid could be a good candidate for this problem, because it is an hygroscopic macromolecular and is highly osmotic, and it has also anti-inflammatory and anti-edematous effects, also bacteriostatic effects, and hygroscopic nature. We know that hyaluronal is normally present on the respiratory surface and promotes tissue healing, cell proliferation, and stimulates ciliary motility. So the aim of the study was to investigate the potential effect of the use of hyaluronal as adjuvant treatment to hasten improvement in nasal aspiration and to minimize patient discomfort in the postoperative radiofrequency volume reduction. So we had two groups, one group with hyaluronal and one group with saline solution, and went to inferior turbinate reduction. And we use also in this case not spray but nasal doses, because the main discomfort of the patient is caused not only but by the edema and crust over the turbinate, the inferior turbinate, but also for the congestion of the osteometal unit and the secretion at this level. And so we would like to put inside the nasal nostril a large amount of drug, and we wanted to have the availability to clean nasal cavity. The most of the patient, more or less 50-60%, were allergic. We use a visual analogic scale to evaluate nasal discomfort in the postoperative period, and we evaluate also all patients with the endoscopic zero-grade examination. The results: the patient treated with hyaluronic showed discomfort, less discomfort than patient treated with saline solution, and also in the endoscopic view.